Um, we have some presentations to make today. I don't even like to call them presentations. You are teaching the class in a very brief little moment about some subject, right? That is your job, is to teach us. Uh, let's go in order here. Miss Bolotic, you had type 1 diabetes. Tell us about type 1 diabetes, if you don't mind. In words that we can understand, too.
So make it short and sweet, or?
Yeah, well, more like I just sometimes people, you guys have researched it and you read all these scientific terms, but we need to understand it. You have to teach us. So just, I don't care if it's long or short, as long as we understand it. Like, does it make sense? So what is it?
Okay, I'll try and keep it short then. So, I got type 1 diabetes, and it's an autoimmune reaction where the body attacks itself by mistake, and it destroys the cells in the pancreas that make insulin. And insulin is important because it helps the process of glucose, which is blood. It's like sugar in your blood, right?
Yeah, that's exactly right.
If the person doesn't have insulin, then glucose can't be transferred and it cannot function properly, making the user feel dizzy, lightheaded, or have frequent headaches.
Yep.
Type 1 diabetes is most common in children, and it's actually almost 85% of people with diabetes under their 20s. But most of the time, people don't find out they have type 1 diabetes until later on in life, where they have type 2. And then there's approximately 30.3 million people with diabetes in the US.
Cool. All right.
And then, did you want us to research about massage as well?
Well, is there anything I should know massage-wise?
Oh,
when
well,
it comes to
a
it?
massage can help because it actually shows that it can help the person, like when they take their insulin, it helps them take it in more, I guess, like
Yep,
absorb
insulin
it,
absorption, they call it. Yep, insulin
Yeah.
absorption. Yep.
So, but yeah, it's a positive thing for them to do.
Cool. That's exactly what I'm talking about. Thank you.
Mm-hmm.
So, type 1 diabetes is diabetes usually that you're born with. It's not diet related. Although it's still diet helps, but it's not diet related. It's not autoimmune disease. Your body has attacked itself and destroyed some of the insulin producing glands in your cells in your pancreas. So you don't pick up sugar out of your bloodstream and put it into fat cells, and it's very dangerous to have a lot of sugar in your bloodstream. Yeah, that's all really helpful. And massage seems to help you process insulin better. So it is helpful, if anything. I think it's fascinating, by the way, that just rubbing somebody helps them utilize their insulin better. Anyway, very, very well done. Thank you. Miss Cooper, we just did type 1. We've got to do type 2, right? Oh, there you go.
Hello.
Good. Hello. So tell us about type 2 diabetes.
Alright, so type 2 diabetes is far more common than type 1, and it's still very serious, but it's less serious than type 1. Type 1 is far more likely to kill you. So it's the same thing. It's when your body isn't producing enough insulin, or isn't producing it well enough the way it's supposed to. So you have too much glucose, sugar in your blood. And type 2 is very common in middle-aged, older adults. Usually because, it can be genetic, but it can also be like you're not eating right, you're not exercising, you're not taking care of yourself, or if you're overweight. A lot of overweight people in America end up getting type 2 diabetes, and it's really sad because it's the #1 cause of death in the world. And it happens like slowly over time usually, and then by the time you realize it, it's too late because you might have already like had a stroke, you know, because it can cause heart attacks and strokes and stuff.
That's right.
And it's kind of sad, but you can take medication like insulin helps.
Mm-hmm.
So
It's very well done. Thank you for putting it in simple terms too. I really appreciate that. All right, everybody. So this one's a little interesting, especially in our country. This is type 2 diabetes. And as Ms. Bolotic first told us, people under 20 who have diabetes, 85% of them, it's type 1. They were born with it. They were born with an insulin deficiency, basically. After that age, type 2 diabetes accounts for 90% of the diabetes in our country. So most people that have diabetes, it is diet related, actually. And here's what happens. You've got fat cells in your body, adipose cells. And part of their job is to store energy. Fat cells are not a bad thing. And they've got little insulin receptors on them, right? And those receptors, when the insulin hits them, it tells the cell to pick up sugar from your bloodstream and put it into the cell and get it out of your bloodstream. That's fantastic. So type 2 diabetes, by the way, they often give people insulin to help them do this, but it's not really an insulin problem. Here's the problem with type 2 diabetes. When you gain weight, how about when Tapscott gains weight, all right? You actually don't get more fat cells. You get bigger fat cells. And so if I've got this as a fat cell and I gain weight, and this is a fat cell, can you see that the distance between these receptors is a lot bigger on the bigger fat cell? It's harder for the insulin to set off the receptors. It's kind of harder for the insulin to find the fat cell receptors. So the pure fact that the cell is larger, it's harder for the insulin to do its job. And it usually is due to weight. So you would never tell a client this because it implies that it implies you're judging them, and I don't mean it that way at all. I just want to point out that in our country, most diabetes is weight related, and that as you get heavier, the fat cell gets bigger, which makes the receptors farther apart and harder for the insulin to find. We treat it in our society with insulin. Well, what does that do? If you pump more insulin in, there's more insulin, and it'll find the receptors. And this will soak up more sugar. But if the person hasn't changed their diet, the insulin actually makes them fatter. And now they're in this negative cycle. And I'm making such a big deal out of this because we talk about lots of killers in our country. But diabetes is like basically the #1 killer in our country. And it's not true in other countries. Other countries with better diet, this is not the #1 killer. And high blood sugar kills you in ways that we don't think about. Like it can mess with your heart function, or you could have a stroke. It's from the diabetes. But people go, oh, he had a heart attack. Well, yes, he had a heart attack, but he had a heart attack because he had diabetes. You can have heart attacks for other reasons too. So this is one of the signs that the American diet is killing us, by the way. Because in other countries, by the way, on different diets, they don't have this problem. They just don't. So most of the diseases that are killing us in this country are diet and exercise related. Anyway, that's type 2.
I forgot something interesting.
Please.
That I didn't know was that if you're not white, like if you're black or Pacific Islander or Latino, you're a lot more likely to get it. I didn't know that.
Yeah. Yes, that's true too. So we all respond to diets differently. And yeah, sugar intake is harder for those groups. Yeah, and it becomes a problem too. Yeah, even bigger problem. Absolutely. We think, by the way, that some of that stuff might have to do with calorie. Oh, go ahead, Miss Monreal. Miss Monreal? You're on, but we can't hear you.
Get more fat cells.
All I heard was get more fat cells. What?
Okay. Can you hear me now?
Yeah.
So you said that we don't get more cells, it just grows?
I mean, by the way, you probably do get more fat cells,
so
but
if we get fat, it's not that we're getting... Okay, well that was my question, because then my next thing was, well then, don't fat cells die? And if they died and you gained weight again, would you get more fat cells?
I don't know, actually.
Okay.
I don't know.
All right.
I'm sorry. No, I love the question. I'm embarrassed. I don't know. I just don't know the answer to that one. Yeah.
Okay.
And you probably do get more fat cells too, but the point is one of the ways your body deals with fat is to actually just make the cell bigger. And that makes it harder for the insulin to find the receptors. Yeah. And so literally losing weight, all of a sudden you pick up insulin better. You know? Yeah. Okay. Awesome. And Miss Cooper, are there any concerns about massaging somebody with type 2 diabetes?
Not that I saw, no.
No, there really aren't. Okay. Cool. Miss Felix Osuna, you were going to tell us about goiters.
Hi.
Hi.
Yes, I'm going to be talking about goiters. They are enlargement of thyroid, which is right below the Adam cycle. It happens mostly in pregnancies or puberty as well. It mostly happens because of iodine deficiency, which is, yeah, it sucks. It's more common in females too. It always is with the other pathologies as well. It is caused by various hypothyroid and hypothyroid conditions. Also, it doesn't really have symptoms. It depends, I guess.
Wait, what? You cut out there a little bit. Can you repeat all that?
Oh, the symptoms? It doesn't really have symptoms. It kind of just, I guess it depends on the person, pretty much, I suppose. Also, it cannot be massaged because it is the inferior neck and the anterior side of the throat. It is the area of caution, so you should avoid massaging. It also contributes to the development of thyrotoxicosis. Is that how you say it?
Yeah.
Yeah, so you should avoid that area as well.
Yeah.
Massaging.
So yeah, I don't think you guys are ever going to see this, but it would be a local contraindication. Yeah. Yeah. Hey, hold on 1 second, everybody. They're trying to move rooms right now, and they're looking at my room like they're licking their chops, and I just want to tell them they can start with the lab first so that they don't, start breaking down this room while we're having class. So bear with me 1 second, I'm sorry.
To lab at 1:15?
No, I'm sorry. Lab in 1:15. You've been having lab in 1:17. You'll now have it 1:15, but the times are not changed.
Alright, cool. Cause I was like, damn, that means like I got like
No.
40 minutes till I gotta get to work.
Yeah, no, we would not do that too. Miss Hanson, you had Hashimoto disease.
Hashimoto disease is an autoimmune disorder that attacks the thyroid slowly over time. Doctors don't know what caused the immune system to attack your thyroid glands. Some scientists think that virus or bacteria might trigger this response. It primarily affects middle-aged women, but can also occur in men, women, and children of any age. You can massage. Be cautious of the anterior neck and throat region, and avoid
Yeah. And it results in what, hypothyroid kind of symptoms, right? Low thyroid symptoms.
I think it starts out with hyper,
Oh.
and then goes into the lower.
Okay. Yeah, I don't know much about it, by the way, everybody. I just know that it ends up resulting in low thyroid problems because the thyroid's getting attacked by the body. So then you get hypothyroid symptoms, which means low energy, low metabolism, things like that. Just a local contraindication, all this stuff, you know, and you probably wouldn't be massaging the front of the throat anyway. Yeah. Okay, there's not much more to say about that. Thank you so much. Okay, we have some organs in our body that also have endocrine cells in them, which means they can make hormones. And I'm hoping to find out what kind of hormones they make, why they make them, do we care, does it have anything to do with massage, that kind of stuff. So, Miss Harper was going to tell us about the kidneys. Where are the kidneys? What are the kidneys? That kind of stuff.
Okay. The kidney is a pair of bean-shaped organs, either side of your spine, below the ribs, and your belly. There's two main hormones that kidneys secrete. It is the erythropoietin and the renin. The erythropoietin, it is a hormone that pushes predominantly by specialized cells in the kidney. Once it is made, it acts on red blood cells to protect them against destruction. And then at the same time, it stimulates stem cells of the bone marrow to increase the production of red blood cells. And the second hormone is the renin. It is a central hormone in the control of blood pressure. Renin, which is released primarily by the kidney, stimulates the formation of angiotensin in blood and tissues, which in turn stimulates the release of aldosterone from the adrenal cortex.
Cool. So your kidneys are essentially filters for your blood. Filters, by the way, just like all filters in the real world, require a certain amount of pressure to operate, by the way. You actually need a pressure differential to kind of push blood through them. And so, believe it or not, when your blood pressure is too low, the kidneys like to kind of kick in and release a hormone that increases blood pressure. And they can also release a hormone that actually encourages your bone marrow, to make more red blood cells, to get more fluid in circulation too, which also helps with blood pressure too. Cool. Any massage considerations?
No, I didn't. I thought this was the functions.
No, it's okay. It's okay. I don't really have any massage considerations at all, except to tell you guys that massage tends to increase kidney activity because you guys are giant sponges, and literally squeezing you really does squeeze water out of your tissue and get it back in your bloodstream, and then your bloodstream processes it and you often pee it out. And that's not a bad thing. So massage, it's very common to have to go pee after a massage because sometimes just because an hour has gone by, but also because the person really is squeezing the sponge of your body and getting more fluid kind of going through your body. Yeah, cool. Miss Hunter. Miss Hunter, are you going to give us... Hi! I could tell... Wow! Thank you. Miss Hunter, I am now excited to hear about the thymus. Where is the...
Give me 1 second.
Yeah! Yeah, with that attitude, be absolutely... Oh, are you... Okay.
Sorry, door is open.
Good. You're in 115, right?
Yeah,
Good.
they kicked me out.
Okay, but 115 is good. Good.
I really enjoyed learning about the thymus. I have like 5 million paragraphs, but I'm not going to read them all because that's ridiculous. But it's very exciting to learn about because okay, first I should probably explain what it is. Well, I really like the thymus because the thymus actually it's like it's almost like the training school for T cells, and they go through the T cells that are in your body, like fighting your foreign invaders and stuff. they actually go through a really rigorous training to even become like specialized T cells. So I thought that was so cool because they actually have like 2 tests. But anyway, I'm not going to go through that. The thymus is a lymphoid organ in the immune system. They say it's called the thymus, and I thought it was thymus, but they said it's called thymus because of its shape being similar to the thyme leaf. But I don't know.
I didn't know. I never knew that. Where is it located?
Yeah.
Where is it?
It is located in the upper front part of the chest, behind the sternum,
Yeah, right about
and
there.
in front of the heart.
Yeah.
Yes. The thymus gland actually does most of its work, or what do you call it? When you are in utero, when you're a baby, it develops and produces your T cells and I guess B cells as well. The gland itself is largest in infants, and then it grows in size into puberty, and then at puberty it stops, and it becomes basically replaced with fat. So it doesn't grow anymore after puberty. It secretes a hormone called thymosin, which stimulates the development of T cells. Sorry, I keep saying thigh, but I don't know. You can
That's
tell me
because I
if I'm
said
pronouncing.
it. I always thought it was thymus, but it could be thymus.
Oh, okay. Well, they say. We'll see. I don't know. Maybe I'm pronouncing thyme wrong. I don't know. Anyway, like the thyme leaf. Anyway. So thymoprotein stimulates lymphocyte production, B and T cells. So that's what it does. Basically, there's a picture in the book that is like really cool because it basically shows exactly like immature T cells go through to the the thymus school, and it comes out mature T cells. But anyway, when I did my research, I learned that only 2% of like the immature T cells actually make it out, like because of the rigorous testing. So that's really great because it's working for you, like your body. Oh, okay. So massage.
Yeah.
So I was like, this is a gland that's hardly like, you know, like I said, after puberty, I mean, it's really nothing really. But I did some research and it says that there's a so-called thing called a thymus thump. And it's basically, people say it's like a small massage where you tap your sternum like 3 times. It's supposed to help with immunity. So I don't know how real that is, but it's huge on Google.
Very cool.
Yeah.
And you said it stimulates B cells as well, not just T cells?
Yes.
What are B cells?
B cells. I don't think I did research on that because I was so excited about the school.
Yeah.
You know.
Well, you nailed the most important stuff.
I'm sorry? Oh, yeah. Okay.
You nailed the most important stuff.
B cells. Did we learn about that already?
No, we did not.
Okay, so I'm supposed to teach you guys. Oops.
No. You have done great.
Hold on. Give me a second. I'll figure it out. Okay. Okay.
I just
It
like
says once B cells mature, they enter the bloodstream where they. Okay. I guess they work kind of in tandem with T cells.
They do.
Yeah.
Yeah. They're a type of white blood cell. Well done. So,
Yep.
so a couple of things, everybody. You will later have to get your clients enthusiastic about massage, right? So I've actually seen massage therapists who are like, well, you should probably get another massage next week with me. And I think Ms. Hunter did a wonderful job displaying about how getting excited about a subject can make you get excited about it, right? And if you're this excited, Ms. Hunter, about, thymus or thymus, it means you'll be this excited about explaining to people why they should get another massage and things like that. So I really appreciate you modeling enthusiasm for us, as well as being very, very well prepared. So I just want to emphasize what she said, which is super cool. B cells and T cells are part of your good guys in your body. They're part of your immune system. and they fight off infection. And the thymus has a lot to do with helping them mature and become powerful fighters. And Miss Hunter latched on to actually a really neat thing, which is they don't all T cells do not become mature T cells. They really do go through like a training process, like they went into boot camp. But this boot camp, only like 2% come out the other end. So it's very cool. So there's these badass little cells kicking ass and taking numbers in your body. And the reason they're also important is because you will often hear people refer to T cell counts in a sick person. Because T cell counts, you want your T cell count to be high if you're sick, but it also tells you how sick somebody is, to be honest with you, because it tells you what kind of infection they're fighting. Anyway, very cool, very helpful. I'm going to start tapping my chest every so often. Couldn't hurt. COVID's going on. Little tap on the chest.
Forgot to add this, because I think this is kind of cool as well. So the ones that don't pass, they like kill themselves.
Yeah.
Or they become regulatory cells. So I don't know.
Yeah. I like that. They're like,
That's like how hardcore this process is.
The disgrace of not becoming a mature T cell, either kill themselves or become an accountant. Yeah, which is almost the same thing. Yeah. Okay, I love it. That's a joke if anybody's an accountant. I'm just kidding. Okay, cool. Thank you. Thank you. You made my day. Mr. Kandaris, you are going to tell us about the prostate, sir.
Alright, so the prostate is located underneath the bladder.
Yeah.
And it is, I guess, on the surface, it would be located behind the testes and in front of the anus.
Yeah, well put. So so I'm assuming since you said testes, it's only found in men.
Yes, this is only found in men. Its main function is to produce this fluid, which basically assists with male ejaculation.
Mm-hmm.
And
That's true.
it's a very small gland, and I was looking up some of the, because I was curious about it, and I was looking at how to basically keep a healthy prostate, and it said a lot of vegetables, and just keeping weight,
Yeah.
If you have weight problems, then it may affect your prostate easier. Yeah. And just reducing red meat and dairy, which I thought was interesting.
Yeah, no, super helpful. And by the way, that well handled. Yeah, that was really well handled. Yeah, so it's prostate gland. It's only in men. It doesn't really have a lot of relation with massage at all. But it is interesting that weight and red meat and dairy tend to be linked with prostate problems. Yeah, yeah.
It can become enlarged, and then it could lead to ED or cancers.
Yes. So yes, it can become enlarged. You can get prostate cancer, or erectile dysfunction is often weight related too. So yeah, yeah. And by the way, since we're on this subject, I think this is okay to cover. So ED is often, which is erectile dysfunction, is often related to prostate problems too, which are weight related. But the other thing that's very interesting about ED that you have to be a little bit careful about is some people call it the canary in the coal mine. Men have very tiny blood vessels in their penises, and erectile function can be also linked to those becoming clogged with cholesterol from a very bad diet. And so they have erectile dysfunction, they go get a pill for that, and the pills work, right? But if that's getting clogged with cholesterol, it would also imply that your heart's getting clogged with cholesterol because they're in the same body. And so it can be a diet-related problem. They call it the canary in the coal mine, and it's a really good time to look at your diet too, because of weight or high cholesterol foods, as you were talking about meat and dairy, can be related to all that too. And so it can be a sign that you might be having a heart attack later, and so it's a sign to start working on some stuff. Just kind of an interesting little side note. Because the reason I really bring it up is because all this stuff is diet-related. Okay, thank you, sir. Miss Monreal, will you tell us about the fascinating thing called the placenta.
Yes, I will.
Okay, hang on.
It's an amazing,
Oh.
amazing thing.
So usually I just like to just talk about it in my own words, and even though I'm gonna do that, I still have to reference the book because it's a bunch of
Yeah,
stuff.
that's exactly what we want.
Okay, so it is a flattened organ, and I don't know if anybody else has seen a placenta, but it looks gross.
It looks like a little coin purse, like a little coin purse. They're tiny.
Oh, well, I'm sorry. I looked at mine after I had a kid. And
Oh, well, you saw it in large. Yes, sorry, yes.
Yeah.
You saw the. Yes, got you. Yes.
Yeah.
It's a
So
massive
it looked
mucus
like,
and blood.
Gross alien.
Yeah.
Yeah. Anyway, so it lines the uterus, and it's kind of like the little house for the baby.
It is.
Yes, and the hormones that it secretes are estrogen and progesterone. And I'm gonna go ahead and try to say this word, even though I know that people call it HCG.
Oh, wow.
Okay.
Okay.
So human chorionic gonadotropin. I don't know.
Human
Right.
chorionic
Anyway,
gonadotropin
that
is correct.
HCG. And so that is a hormone that is in pregnant women. And I don't know if you ladies know about HCG diet, where they give you the hormone because it is going to force your body to lose weight. Anyway, that's off the subject. So what that hormone does is, let me get this right. It has an antibody effect by decreasing lymphocyte activity, and thus it protects the embryo from the mother's body rejecting it. I thought that was super interesting.
It's super interesting because it ties into other problems that sometimes happen with birth, right? So, because sometimes the body is like, hey, like this isn't me and it's growing.
Yeah.
We should attack it. And you don't want that happening. That's your child. Yes. Fascinating. Keep going.
Right.
Sorry.
So one of the other things that hormones that it secretes is placental lactogens, and that promotes the growth of the mammary glands within the breast in preparation for lactation.
Yeah.
It also will stimulate maternal and fetal metabolism. And then it also secretes relaxin, which we talked about yesterday.
Yes, we did.
And so I don't know if we talked about this yesterday, but I thought this was interesting also. So relaxin works synergistically with progesterone to maintain the pregnancy by facilitating relaxation of the uterine wall to reduce the risk of miscarriage or premature birth. I thought that was really cool.
Yeah, the uterus wants to contract. That's like its job. And it wants to, and you got to kind of like hold it back, buddy. Wait, yeah.
And then towards the end of the pregnancy is when relaxin will help with the cervix and will help the cervix relax and dilate. And it will relax the pelvic ligaments to assist in childbirth.
Yeah. Yeah. And remember, by the way, everybody, that massage has been proven to make birth go better. So, and again, massage relaxes you. So there really is a stress-related kind of thing there. That's awesome. Thank you. Well said. So the placenta is essentially, by the way, the thing that gets nutrients from the mom into the baby and creates the house for the baby. Well said. Well said.
A couple other things that
Please.
I thought were interesting is that they can look at the placenta when there's been things wrong with the baby, so they use it to find out like exactly what went wrong.
Yeah.
Also something that I don't want to be offensive to anybody just in case, but that I thought was a little gross, is that some cultures you eat the placenta.
In this culture, some people, I have friends who have eaten the placenta. They go home and cook it and eat it.
Yeah, so anyway, I thought that was weird, but then they also use the placenta for stem cells.
Yes.
And, I mean, that's kind of cool depending on what your reasons are. But anyway,
Right, that's a whole, that's a controversial subject too, but it's neat,
Yeah.
and it's scientifically important to know.
it's interesting.
It is interesting.
So
Yeah,
anyway, that's it.
cool. And I will say about gross subjects, and I don't mean that's actually gross, I just meant we do stuff that other people think is really gross too. You know what I mean? So,
Right.
everybody does. It's just how you were raised. Very interesting. Thank you. That was awesome. Awesome.
I have a question about that.
Please.
So, in people eating the placenta, is that because of the nutrients that it's supposed to give?
I mean, that is why animals usually eat the placenta, right? We believe that they eat that to get nutrients back that they would have lost. I mean, waste not, want not kind of thing. But the few people I've known that have done it, like the husband and wife have done it, it's kind of a ritual kind of thing. You know, like we've had a baby together, and I don't get it. I didn't delve into that conversation with them. So, I don't know. Be a good thing to research.
I know a few women that have ground it up and put it in pill form and take it as pills.
Oh, and maybe they're thinking they're getting some type of important nutrient from that.
Right here it says that eating the placenta say that it can raise your energy and breast milk quality.
Maybe.
And they also say it can level off your hormones.
Yeah. I don't know.
Okay. So I have a really weird question.
Sure.
And I just have to ask.
Of course, and of course it has to be you.
Did they tell you what it tastes like?
No, I just remember it was a husband and wife, and they actually cooked it and ate it. And I was like, so I guess, to me, that didn't seem like you're doing it for the nutrients. It seemed to me like you were doing it something together. And I was like, okay. And to be honest with you, I didn't think it was that weird because, I mean, I thought it was unusual in our culture weird, but I didn't think it was that weird because animals eat their placenta, and people eat bugs, and we eat cows, and like all this stuff is just stuff you know what I mean? People do all sorts of weird stuff.
Yeah.
And I was like, it's not a crazy idea. It's not like animals don't do that. And we're animals, by the way. We always forget we're animals. Just because you put on clothes and you comb your hair, you're an animal. You know.
We
What, Miss Torres?
we bats that create coronavirus now.
Yeah, we eat all sorts of stuff. So, bats and frogs and lizards and, you know. So anyway, but no, they didn't say what it, it tasted like. Whew. I'll see if I can't find that out. Yeah, I would guess, by the way, it would be like liver and irony. I really would. But we'll find out. Yeah. Wait, we're getting feedback here. Okay. All right. So, it has been an interesting day so far. Okay, Miss Nguyen. Miss Nguyen, you were going to talk to us about the lining. It really is the lining of the gastrointestinal tract, which is your eating tube that runs all the way down in your stomach, your throat, stomach, large intestine, small intestine, large intestine. Yes. Please.
The most car in the most inside layer.
Yes.
A most inside layer and up in the contract with gastrointestinal, but you can call it the GI, right?
Oh yeah, thank you. So the gastrointestinal, this tract that runs from your mouth to your butt, can be called the GI tract.
The yeah. And it have the three layer. One inside you can call epiderm, and medium you can call potria. I don't know how that say.
I don't know what you're saying, but I'm not worried about it. Keep going. We'll figure it out.
And then have the three layer, inside, medium, and outside. and muscle in the can moving foot, in the
Yes.
moving foot and poop,
Yeah. Yeah.
and them in the pop in the mouth, and nose, right?
Oh, and nose?
Yeah.
Okay.
Including in the stomach.
Yeah.
And intestinal. I don't know how. Intestinal.
Intestinal. You're good.
Yeah. So I send for you that, but you can you can tell everybody that, but I don't know how to say that.
Brain is the innermost tunic. Oh, tunic. It's an interesting way to put it. Of the wall lines the lumen and the digestive tract. Okay. Cool. Can I sum this up a little bit? Once again, my hat's off to you. If I had to speak a foreign language and then they were like, talk to us about medical stuff in the foreign language, I'd be like, I just wanted to ask where the bathroom was and how to order a beer. So, really hard stuff. So, what's interesting is you have a gastrointestinal tract. That's your digestive tract. We're going to study it, but what's really interesting about it is essentially what happens is food, you chew food, you make it into little balls, and your gastrointestinal tract, because of the smooth muscle around it, squeezes it on down. You have powerful acids in your stomach, so you have to have a mucus lining. So the mucus in your nose and stuff like that everybody's like, gross, it's super not gross, it's super important. The mucus in your nose catches all sorts of stuff it's not supposed to, and the mucus lining of your stomach keeps the acid in your stomach from eating through the walls of your body. So this mucus is amazing. And then as this stuff moves along into the small intestine and the large intestine, there are mucus linings there too that help this food, because poop is food, it's just composted food, is moving down through your body. What's interesting is you secrete a couple of hormones in your GI tract. One is a hormone that actually encourages this mucus production, which is really important to moving food through and keeping your acid where it's supposed to be. But the other one that's interesting is when your gastrointestinal tract becomes empty, it starts to release a hormone that makes you very hungry. So if you empty it, like if you fast, this hormone level raises really fast to make you hungry, because your gastrointestinal tract is like, there's something wrong here. We're supposed to have food moving through here too. The other thing that's really interesting is there's a lot of research now about the health of your gut, they call it, which is the health of your gastrointestinal tract here. And essentially your gastrointestinal tract has bacteria in it. And yeah, it has bacteria in it that eats your food for you. And that bacteria is responsible for some of your cravings, because your bacteria actually wants you to eat the stuff that feeds it very well. And people that live in families and households together have very similar bacteria in their gut. They actually, because you share it without realizing it. And some animals have to get that bacteria when they're first born so they can digest food. So I think I was telling Miss Petrie this once in a conversation we had, that little baby koalas, koalas smell like eucalyptus because that's what they eat, and they actually smell like eucalyptus. Well, eucalyptus is really hard to digest. So when a baby koala is born, its mother takes some of her poop and feeds it to the baby. Well, that poop has the bacteria in it necessary for digesting eucalyptus leaves, because the koala doesn't really digest them, it's the bacteria. You don't really digest food, it's the bacteria in your body that digests it for you, does you that favor. So you do the favor of providing a happy home for the bacteria, and it does you the favor of breaking down your food for you. Very good. Thank you. Good stuff. Lots of stuff.
So in the game in the cannot massage, right? Because the inside, but you can massage on the back and something, but you cannot massage inside, and I don't know about that.
Yeah.
Yeah.
Yeah. You cannot massage inside the body. It's against the law. No, I'm saying that, like, you have to really be careful. Even if I'm going to put my finger in somebody's ear, I talk to them about that. But you definitely can't massage inside the body in Arizona. There are places where some people do certain types of massage that are kind of inside the body. But no.
No massage.
No massage.
Yeah.
But you can massage tummies. And that's where the gastrointestinal tract is. And it helps digestion, people. You can massage stuff around. Has anybody here had a colonic?
Mm-hmm.
Yeah? And they sit there and they massage your stomach while they've got all this water pumped up in your intestines, and you can feel stuff moving along in there. But anyway, you can massage somebody's stomach, and some people like stomach massage. A lot.
Yeah.
A lot.
Yeah.
And in Europe, actually, it's kind of just done in every massage, really. It's just kind of a thing. In the United States, we don't do stomach massage as much, but we will do it here. It's cool. But anyway, it helps your digestion.
Yeah.
No doubt about it. Thank you.
Hey, Mr. Tepsko, I have a question.
Yes, Miss Bellotic. What is your question?
So, like, with what gland, like, what area is the feeling of hunger come from? Like, what is it?
So,
Does that make sense?
I don't fully know that, by the way. You have cells in your intestines that will release a hormone that makes you feel hungrier, but I suspect that works because that hormone affects your brain. And your brain tells you that you're hungry. Your actual feeling of hunger is coming from a brain signal.
Okay.
Yeah.
Okay.
So the gland would be your brain ultimately. But there are things that feed that, right? That set your brain off to make it think it's hungry. Yeah. Miss Petrie, you are going to tell us about the heart. What is the heart?
What is it?
Yeah.
It's the heart. I mean, you have to have it, or
Cool. Where is it?
it's in your chest. It's your heart.
Thank you. It's right here. Yeah. About the size of your fist. Yeah.
Yeah, about the size of your fist. Okay, so I actually wrote down a lot of information, and some of it I don't understand myself. So I've been trying to figure out how to even
Present it.
explain things
Sure.
that I don't totally understand. So I'm just gonna do my best.
Yeah. And do what I do. If I don't understand something, I just don't tell you guys about it.
So sorry. Okay, so the heart is an endocrine function that is ensured among others by cardiac NPS. NPS, by the way, is, I wrote it down. Oh man, I wrote it down and now I can't find it.
Let's see if I've got something on it.
I wrote it down and now I can't find where I wrote it down at. So never mind.
Okay. Skip that for a second.
Okay, so cardiac NPS plays a fundamental role in hydrosodium regulation, modulating blood volume. They help to regulate the blood pressure over the long term.
Yeah.
So then it goes into hormonal regulation is not possible without a cardiovascular system. The heart plays a special role not only in the action and its synthesis, but also in the distribution of hormones. It says the severe endocrine disorders with cardiac involvement are often threatening for the patient. The impacts of aberrant thyroid function, the sympathetic adrenal symptoms of which predominantly affect the heart, is well known. Diabetes mellitus and the associated metabolic syndrome are major causes of cardiovascular disease and determine its morbidity of lethality rates.
Lethality, yeah. So a couple things. One is the heart does something really cool, which it regulates some of its own blood pressure. So it's a pump.
Right.
And so blood pressure is really important. So one of the things it does is it releases hormones that tell the kidneys whether they should lose more water or retain more water, because that helps your blood volume. You're basically these pipes running around your body. And if you've got more water in those pipes, the blood pressure is up higher. And if you've got less, it lowers it. And so the heart cares about that stuff. And so it can help to regulate the blood pressure it needs.
Yeah.
I like how you, go ahead.
Blood pressure and raised levels of lipids.
Yes, lipids are fats floating around.
Blood fat.
Yep, they're fats.
And cholesterol and triglycerides.
Triglycerides. Yeah.
Triglycerides. Okay.
So fats running around your bloodstream. By the way, fats are good. And they're also I mean, you need them for lots of reasons. And many hormones are essentially fat-based, so that's not necessarily a bad thing at all. But anyway, I like how you tied it back in that diabetes can affect heart function. And what you were saying about morbidity is that when there are problems with your hormone system and your heart, because your heart has to pump the hormones around your body to get the messages out, then you're in double trouble. Well said. Good.
It also says that natriuretic peptide, which functions to reduce blood volume, pressure, and Na+, which is sodium concentration.
Yes.
Also acts on the kidneys to increase sodium and water excretion.
Yeah. So again, that's where it's lowering its blood pressure there, if it thinks it's too high. And it's telling the kidneys, dump fluids for us, please. Yeah.
Okay.
Very cool. Very cool. So essentially the heart can help regulate some of its blood pressure. And remember, if massage does anything, it lowers blood pressure, right?
Yes.
Right. So, which is hypotension is low blood pressure, hypertension is high blood pressure. And as massage therapists, we care more about hypotension because their blood pressure goes down even further on the massage table. They get back up again and they can pass out. High blood pressure, hypertension, is a danger, but it's not a danger in massage. I don't care at all if you have high blood pressure and get a massage. I care if you have high blood pressure in general. Okay, Miss Stanley, will you tell us what adipocytes are, for one thing? That's really what I really want to know. And anything else you want to add?
Cells.
They're fat cells. That's exactly right. Adipose is fat tissue, and adipocytes, sites mean cells. They're fat cells. Well done.
Yep. So I wanted to start out with answering Miss Monreal's question from earlier. She asked if fat cells just like die off and if they get replaced. And the answer is pretty much yes. Every year, the human body loses 10% of its adipocytes. They die off, and yes, they get replaced with more.
Bummer. Yeah. Okay. Thank you, by the way.
And the hormones they produce, the adipocytes anyways, they produce leptin and resistin. They do two different things. The leptin has to do with metabolism and energy regulation, and sometimes it can even basically decide, like it controls your decision whether or not you're like hungry or not. And then resistin increases your blood sugar, and I have a lot written down, I'm sorry.
That's okay. Don't be sorry that you researched for your presentation. I'm happy.
It's less sensitive to actions of like insulin.
Yeah. That's why it's called resistant. Yeah. Cool.
It's really cool. And it's actually obviously we kind of learned it earlier, it's a possible link between type 2 diabetes.
Yeah.
And then I also learned an interesting kind of like, I want to call it a fun fact, but probably pretty boring to most people, but I thought it was interesting. There's 3 types of fat. There's white, brown, and beige.
This is not boring. Tell us about the 3 types of fat.
So the white fat contains a single lipid droplet and it can store energy for you. The brown contains many lipid droplets, mostly generating heat for us. And then the beige is very similar to brown, as in it basically kind of does the same thing, but its difference is it kind of hides within the white adipocytes. It's just like in a little group with them, and it has a lower level protein called UCPI.
Interesting.
I don't know what it stands for though.
I'm not actually familiar with the beige. I only know brown and white. But have you guys ever eaten a really big meal and woken up really sweaty on the back of your neck? No, just me. Great. Thanks, guys. Thanks for leaving me hanging. Quite often that's your brown fat cells. You've got a big store of them back here. You've got them in lots of places, but you have a big store back here on the back of your neck. And when your body recognizes that you've eaten too many calories, it does try to help you. And the brown fat cells try to burn off some of those calories, some of that fat is heat. And so you'll often get really warm and sweaty back there.
Okay, so I've eaten a lot of pretty big meals, but I've never experienced the sweatiness on the back of the neck.
What about
So
sweatiness on your chest? What about sweatiness anywhere?
No, but I'm not someone who sweats very much, so I wonder if that
Yeah,
probably plays into it.
yeah. And by the way,
I
Miss
think that's-
Monreal, what might be kind of like, so some people have more brown fat cells than others. And those lucky people like me, they might wake up sweaty, but it also means they can burn off some of those calories they're eating. And you might have
So I have a question.
I'm gonna go have a big meal just so I can test this out.
Yeah, it's good. Making sure it's greasy too. What, Miss Torres?
So, okay, I don't know. So is that why some people have brown on their neck, like the color brown?
I don't think
I
so.
don't know.
Yeah, I love what you're saying, but I don't think so. I think that's totally pigmentation.
But I know it happens for when something in your body is happening, and that's because of the weight. I know it's something. It has to do with that, not because of the sun or anything. But I just now that you're talking about
I know what she's talking about, and you're right. It is actually associated with people who are overweight,
What is it?
but it's not because of the weight. It's because something isn't functioning right, probably because they have poor diet.
Oh, so it's poor diet
Yes,
showing up in their
yes.
skin?
But I didn't know about the brown cells.
Yeah. So you're saying, Ms. Monreal, it's not related to brown fat cells. You're just saying it is a weight-related issue that the poor diet, or well, shouldn't say weight-related. It is a poor diet issue that shows up in a discoloration of the skin around the neck.
Yeah, and it's actually, they can even have like raised skin cells on there, so like almost it would even look like a brown rash. I feel like that's a little bit misleading to describe it that way, but it can go away. I do know that.
Cool. All right. I love it. Thank you. I didn't know that either. Okay. So, Ms. Torres, I'm glad you're thinking and talking because you had kind of a difficult assignment, which is to just tell us the hormones associated with stress.
Yes. Okay, so there are 3 different hormones associated with stress, but there are only 2 main ones, and they are cortisol and adrenaline. But the main one is cortisol. So you release the cortisol through your adrenal glands into your bloodstream. It increases your heart rate and your blood pressure. And it enhances your brain's use of glucose, which is not a bad thing when it happens occasionally because that triggers your flight and fight response. So that's what has been keeping us alive for all these thousands of years. So it's not a bad thing, but it's a bad thing because when that happens, we release estrogen. And when we release estrogen, or when the levels of estrogen are low, then that's when the issue, that's when it becomes an issue, because then there's problems with your mood swing, anxiety, memory problems. So all these things are happening because of your estrogen being low. So if you're stressed all the time, that means your estrogen is low all the time. So those problems could aggravate throughout the years. And let me see. So some of the problems, like I said, are like mood swings and all the like bad stuff that happen. But I have a list of. Let me find it. So some of the other consequences, I guess, is like fatigue, headaches, intestinal problems, anxiety, depression, weight gain, blood pressure or increased,
And poor sleep. So things that are gonna help to release hormones are exercise, which is one of the main thing to do, and massage. So yeah, getting a massage regularly will put you in that parasympathetic
Parasympathetic, yeah.
state, parasympathetic stage, which is gonna help to be better, to heal and rest and digest and cure you.
Yeah. Yeah, guys, if you remember one thing from this presentation, even though I heard lots of really amazing stuff, but cortisol levels are something they really use to measure your stress level. And the problem is when you are stressed, when you are in the sympathetic state, you tend to have digestion problems because your body is shutting down the digestion, right? It's shutting down its repair. You tend to have sleep problems because you're hypervigilant, you're very awake. And that then creates all sorts of other problems, right? So anyway, yeah, stress is a killer, and massage has been proven. Touching people, just touching them in a healthy, safe manner has been proven to lower cortisol levels fairly dramatically, by the way. So have kitty cats, I want to say, and really good boyfriends and husbands and children. They do lower cortisol levels, being around loving kind of situations. But massage is an instant stress lower, absolutely. Well done, thank you. Ms. Yanez, last but not least, you were going to tell us hormones associated with like well-being. It was a vague assignment, I apologize.
So I looked at hormones of well-being that get released when you have a massage.
I love that.
So the first one was serotonin, and it's a neurohormone, and it helps with controlling emotions, especially those of annoyance. And it's been shown to help with sleep and certain psychological problems. Another one is dopamine, and that's what makes people feel happy, and it also brings a clarity of thinking. And the website that I researched on was like, it's basically your body's happy juice is what it does for you.
Yeah.
And one of the other ones I looked up, because there was a lot, was endorphins. And that's a chemical hormone, and it gives you the feeling of euphoria. And something interesting about that is the endorphins released during a massage can like last your client up to 2 days.
Yeah.
So they feel really great for like 2 days.
And not to correct you, but serotonin and dopamine are endorphins. Like they're under that category. But well said. You actually hit the two I was hoping you'd hit. So serotonin and dopamine, these are kind of our love and connection hormones, by the way. They drop stress tremendously. And they're the reason your client feels like they're in love with you after the massage. And I don't mean they're deeply in love with you and they can't live without you, but just that feeling of like, oh my gosh, you guys have felt it in the lab already, I bet. When somebody gives you a massage, sometimes you're like, oh. These are very good hormones to have pumping in your body when they're naturally produced. When they're not naturally produced, it creates a problem because you run out of them. But when they're naturally produced, they're very, very helpful. And this is the reason you want to rebook your client right after the massage. So if Miss Yanez gets a massage from me and I've done my job right, and I've paid attention to her and I've listened to her and I've given her a good massage, she's now loaded with serotonin and dopamine. These are connective, loving hormones. She feels at peace. She feels very grateful for me, for the massage, and she gets up and I don't want to bother her. I'm just going to let her go home and I'll schedule her later. No. I'm going to say, hey, Miss Yanez, I know this massage was $100, but if you rebook and pay right now while you're already paying for this one, I'll give you the next one for $80. So you just give me $180 right now. I'm swiping your card anyway. And she's like, well, that's $20 off. Why would I give her such a big discount? Because if she goes home and 2 days later this wears off, I don't hear from her for another month and a half. Because Valentine's Day comes up for her, and then her mom needs something, and then her sister, and then the car, and right? But now she's got to pay for a massage for $80, and she's going to come back next week and use that. It's already paid for. And at the end of that one, I'll say, hey, let's rebook again, $80, prepay. Yeah, go ahead, Miss Monreal.
I was gonna ask, so what about when she comes in the next time?
2 minutes.
Do you give them the same deal? That's what I was gonna ask.
Yeah, I would every time. If you will prepay and book, I will give you a discount. Because you will come back in. People will use a prepaid massage and they will come back in so much more regularly. It's really, really worth it. Okay, everybody, I have to, oh, go ahead.